Hello there. This is Andrew Kolsky again with Stop My OCD and anxietyenders.com. Today on our podcast, we have Molly Church, and she is a clinical psych postdoc fellow. Long title for someone who works at Baylor College of Medicine. And I'm going to have Molly introduce herself in a little bit more detail to us. Molly, take it away.
Yeah, so hi, thank you again for having me on to talk with everyone. So I'm Molly Church. I do have a very long title. So clinical psychology postdoctoral fellow at Baylor College of Medicine, Menninger Psychiatry departments, behavioral health sciences, OCD and related disorders clinic. So it's a mouthful, but really grateful for the work that I get to do here. And I just finished my doctoral training. So it's been a very exciting time. Yeah.
Congratulations. How many
Thank
years
you.
in school to do that?
Five. So lots of training, lots of therapy experience. And I'm just grateful to keep on doing the work that we do. Yeah.
Great. So right now, today, your status, tell us the types of things that you do today in your job.
Yeah, so today, my job here, so I'm a therapist at the OCD and related disorders clinic. So I do therapy with adults, kids, teenagers that experience OCD and other related disorders and anxiety disorders. So kind of that whole spectrum. And I'm also a researcher here at the clinic as well on a couple projects, and then I have a project of my own I'm working on as well.
Fantastic.
Yeah.
And I know we're gonna talk about your project in a little bit, but I wanted to give the audience an opportunity to learn a little bit more about you first.
Yeah.
So, this is obviously a very unique area for someone to be practicing in. Tell us,
Mhm.
how did you get into this area in the first place?
Yeah. So during those 5 years, I had the honor and privilege to train at an OCD clinic as a practicum student in my therapy training. And so, really, what got me interested and passionate about OCD and OCD treatment was working with the patients themselves and really seeing the impact that OCD has on people's quality of life, on their mental health, and also just how commonly misunderstood OCD is too, and how that it can impact people as well. And I was also really impacted by the strength and bravery that it takes for patients to come in and get help and treatment and do evidence-based treatment of exposure and response prevention, which is really hard work. Like it's really hard. People come in and face their fears every day. And so to help and work alongside people that are willing to do that in order to get things back that they value that maybe OCD has taken from them, improve their quality of life. I really found purpose in that. And then also, it's just amazing how effective the treatment is, and to see that work and to have patients experience that too, to get those moments back of, okay, OCD told me that I couldn't hug my family members and I needed to avoid that. And then at the end of treatment, seeing them hug their family members and being able to do things that are really important to them. So that's kind of what got me interested. And then I've just been hooked ever since and really passionate about the work.
That's great. That's great. There's a lot in there that I want to follow up on because you
Yeah. Yeah.
I like to talk about. Um,
Yeah.
so yeah, I also got into the practice of treating OCD for the same purposes that you're describing, because you can really see the benefits of the work that you do, and have a patient come in with this massive amount of distress, and then they're able to learn how to work through it, and that's really
Yeah.
rewarding. Um,
Yeah.
you said something that I'm curious about your thoughts on, and there's probably no research one way or the other to support it, but I'm just curious about your
Mhm.
thoughts. I was doing a training just yesterday, actually. I was training other therapists about OCD treatment. And
Mhm.
part of the training, we talk about data and statistics. And we were talking about the number of people estimated to have OCD in the general population. And what I said to them was, when I was a therapist and I was practicing before I knew anything about OCD, I had some patients that I didn't fully understand what was going on. Eventually, I learned about OCD and I look back and it's like, oh, these patients had OCD. So I was
Mhm.
saying that, based on my conversations with a lot of other therapists, my bet is that there's a lot more OCD than we see in the numbers because it's so often missed and therefore not diagnosed, and then it doesn't show up. Do you have a similar feeling or do you see it differently?
Yeah, I think anecdotally, kind of just not sure of the data, but yeah, I would agree. And especially because, I mean, and I tell this to patients all the time, right? OCD is so sneaky. Like it can just sneak in all of these different ways that I think you can be working in the field for however long and you still kind of have to stay fresh and know, okay, how OCD might appear and be curious about patients' presentations too, to kind of get a sense of what's popping up here because it can so commonly go under the radar or be diagnosed as something else. Yeah, it's a tricky one, but I think it's really important and one that's interesting to work with and see how it can present and just have your flags up for other people and to help kind of provide education just generally kind of like you were saying about how does it look, how can we tell, how might it appear in some people in ways that might be a little bit sneaky and under the radar that we might not initially catch.
Yeah, yeah, and I just that's what made me, say that just personally without data,
Yeah,
I
yeah,
have to believe there's probably more
yeah,
OCD than maybe we're aware of.
yes,
But the
yeah,
good news is that we can do something about it. So that's the best
yes,
about this whole thing.
yes, exactly.
You said another thing that I'm curious about. I speak to so many therapists, including myself,
Mhm,
who go through their basic master's program, and even psychologists who go through a doctorate program, who,
mhm.
we talk about, do you ever learn anything about OCD in your program? And generally across the board, the answer is nope, never talk about it, never have any training in it, only learned about it in practice. You happen to be at a program where they're doing some really really great work with OCD, so
Yeah.
you came across it there. Did you have any interest or knowledge about OCD before you happened to be in your particular program?
I don't think before I started grad school, no. And then trying to even think back to my coursework, and I had a professor actually. I was lucky enough to have a professor who specialized in anxiety and OCD. So we had some coursework in our just general classes that everyone took. But outside of that, no, not before grad school. And so I think that's another thing is, yeah, it happens so often. And then until your radar gets peaked about it, you may never really hear about it. Yeah.
Yeah, yeah, and that's the thing. So it's I really wish that the core curriculum for master's programs as well as all other
Hmm.
programs
Hmm.
did at least some element, because we're putting
Yeah.
people there and we're not giving them the education about this that they need, and then they get kind of caught off guard because they were never taught about it. It's not their fault, they're not doing anything wrong, they just
Yeah.
were taught about it.
Yeah. And that's why it's important for providers and also this platform, right, to get information out about OCD and anxiety, what it looks like, what the treatment of it is, to help with that and to help provide education and just increase awareness. And I know one of my kind of professional goals just as I go along in my career is doing just that, is kind of helping get the word out about this because it is so important.
Right, right.
Yeah. Yeah.
So, so if someone in the audience of this podcast is watching and they are wondering to themselves or thinking to themselves, maybe they have OCD, but they're not sure, they're not clear. And, I realize that there's a scientific definition of OCD, but
Yeah.
in general, what would you say to them? What types of things should they be kind of looking for themselves, just to decide whether they even want to reach out for treatment?
Yeah, so I think if there's kind of a place nearby that does assessments, again, an assessment by a professional is always kind of the firsthand line. But thinking about if there are any intrusive thoughts that pop into your head that stick around and are really distressing, and they happen frequently, and then you feel the need to do something after to get rid of that feeling. And if you're not able to, in the way that OCD might, or that your brain might tell you to do, then that causes extreme distress. Or if you're finding that you're avoiding lots of things out of fear of something bad happening, just kind of being curious about your own experience and noticing how you're responding to your thoughts, how you're responding to anxiety when it comes up, and if there's anything that you feel the need to do after. So again, that kind of classic definition, but more in how does it impact people? Yeah.
Yeah, because there's certainly a lot of people who I talk to who talk about, oh, I have these intrusive thoughts and I don't know where they're coming from and I don't know what to do about them. And then, we get
Yeah.
a deeper conversation and we talk about, obsessions and what they are and compulsions and what they are. And then we
Yeah.
do a formalized assessment like you were referencing.
Yeah. I
So
think another piece, sorry, is we all have intrusive thoughts, right? Like we all just have thoughts that pop into our head. And so the response that you have to those can really tell a lot and kind of say a lot. So I could have the thought, oh, this person's driving really slow. I just want to ram my car into them, right? I could have that intrusive thought and go, oh, okay, that's kind of a weird thought. Wonder where that came from. All right, I'm going to move on. Someone with OCD would have that thought and then have fear and anxiety related to it of what does this mean? And then really ritualizing after. And so just that response can also be helpful. And I think too, around like, oh, I just have these intrusive thoughts, and normalizing too that we all have those. It's just the response that can impact the down the line of that. Yeah.
yeah, when it gets really obsessive, they can't
Yes.
that thought, that's
Yes.
probably
Yeah.
it.
And it causes distress. Yeah.
Yeah.
Exactly.
Um, so you work with people who come in and you assess, assuming they do have OCD. You were talking about the treatment. So tell us a little bit more about how treatment works in your facility. Specifically, what type of treatments do you use? And do they hurt? Are they scary? Tell us about them.
Yeah, so we do evidence-based treatment here, so CBT and especially ERP, or exposure and response prevention for OCD. It's the evidence-based treatment. It's the gold standard. And I know when I first tell it to patients, it often sounds scary. And I'll tell them, like, I know you're probably looking at me like I have two heads, but really, like, this is what works. And so exposure and response prevention involves putting yourself in a situation that brings on these obsessions, or triggers those obsessions, and tolerating the anxiety and discomfort, and not doing the ritual. And we go about this in a very strategic way. So we're not starting at like the peak of anxiety. And I say, like, if I started out with doing something, like, for me, I don't like spiders. So if I put a spider in my hand, oh my gosh, I'd be out of here. Like, that's my 10 out of 10. So starting at kind of a level that's more manageable for people. So like a 5 or a 6. So feeling some anxiety and distress. And then from that, they learn, okay, I can tolerate this, right? And actually have a new response develop to these triggers of, okay, I don't have to do the ritual. I can tolerate this distress. And it's what works, and it's what's effective. And again, it takes strength and bravery. And I'm really kind of honored to work with people that come in and are like, yes, I want to do this and I'm willing to do this and work really hard. It works to decrease OCD symptoms and severity.
So just as an example, you were talking about, putting a spider in your hand.
Yeah.
Ooh, that would be really, really high anxiety.
Yes. Okay.
So what would be something that you would do that's less anxiety provoking for that type of circumstance?
Yeah. So for me, it might be man, I'm already feeling like I'm feeling my subjective units of distress increase even just thinking about this. So looking at pictures might even be one for me. But also, if somebody has a spider in a cage open in the doorway, right? So experiencing that trigger and that fear in some way and tolerating that distress and learning, okay, I can stay in this, and just by time, all right, I was able to do that, and then easing our way into some of the harder stuff. Like maybe one day I will do an exposure where I have a spider in my hand.
Right, right.
Yeah. Yeah.
That's that's the important piece there, is that, like you said, it's slowly working up. So you're not diving into the deep end, you're slowly wading into the shallow end and working your way towards the deep end. It's one way to
Yes.
guess. So yeah, I agree. I always tell my patients, we're never going to do anything that you're not ready for. I am
Mhm.
going to encourage you to feel distress because that's part of the treatment, but we're never going to go further than you're ready for.
Mhm.
So
Mhm.
yeah.
Mm.
So so another question that comes up often is, before someone has started treatment, they always want to know, well, how long is it going to take? How do you answer that question?
I always say it depends, right? It depends on a lot of different factors, right? If there are how long OCD has been going on and untreated, that can impact it. If there are comorbidities or other disorders that are happening at the same time, that can impact it. Yeah. And usually, kind of, I say it depends. We'll see how we go and as progress is going. And also, I think one thing that I try to encourage in people is recognizing that progress in treatment is not linear, and setting out that expectation from the beginning, because it can be tough if you're a few weeks in, you saw progress, and then something happens and we go down again. And so normalizing that aspect of it too.
Yeah, yeah. No, I haven't come up with like the perfect answer to that question yet, but basically,
Yes.
everyone is different, and
Yeah,
we finish treatment when treatment is finished. When you get
exactly. It can't be rushed, right? Yeah.
so. But and then once they start the treatment, they quickly understand what I mean. It's
Yes.
but overall, in my experience, and again, got no data to back it up, just my experience, generally I see OCD treatment go quicker than other types of disorders that I might treat. So
Yes. Yeah, and I think it's that, like you're saying, once they do it, it's that behavioral piece of, okay, I'm learning this. And also, I always tell patients too, like, my goal is for you to not need me anymore. So also the behavioral piece that they learn, but also how to respond to OCD when and if it comes up again, or um, just knowing how to respond in a way that's consistent with exposure and response prevention and all of that, so that they have the skills and tools themselves as well. Yeah.
yeah, exactly. Yeah,
Yeah.
that's part of my talk with my patients as well,
Yeah.
is we're treating what you have, but we're also helping you build the skills so that in the
Yes.
future, should something come
Yeah.
up, you're prepared. So
Yeah. Yeah.
so in your experience, then, would you say that everybody with OCD who goes through exposure and response prevention is going to benefit, or are there a certain number of people that maybe don't benefit from it?
I mean, it's evidence-based treatment, so people benefit from it, right? And thinking about too that there are different pieces that may contribute if there are difficulties with it working, that um, maybe it isn't the right time for the patient, or there are other kind of things that are popping up. But in general, yeah, exposure and response prevention, it works. Yeah.
Great,
Yeah.
great. That's why it's the gold standard, right?
Yeah, that's why it's the gold standard. That's why it's out there, and yeah, everyone does it. So.
Now, another question I get is, what about medication? Do some of your patients take medication or not? How do you all deal with that?
Mhm. Yeah, so within the clinic here, there's a psychiatry department as well, and so patients consult with them on medication, and can take it as needed, or if they want to consult. Sometimes maybe with more severe cases of OCD, getting some kind of medical or medication kind of pieces in there too. So yeah.
Great, great. Yeah, that's another thing that I find very hard in my practice is to find psychiatrists who are trained in OCD and understand the medications and the
Hmm.
proper doses, which is really important when we talk about it.
Hmm.
Um,
Yes.
again, it's because uh, we just don't teach it in schools the way that I would prefer it was taught in schools.
Hmm.
So
Hmm.
things we have to all learn as practitioners afterwards. You've been fortunate enough to be in a really great program and learn from the best. So
Yes.
you're way
Yeah. Yeah. Yes, yeah. And I really appreciated learning from everyone here on, yeah, just all the different pieces of OCD and OCD treatment, and getting to learn and see it done at its best. Yeah.
yeah. So all right. So we all can tell that you are very knowledgeable about OCD and obviously do a great job with your patients. And then that must lead to the research part of your job. So tell us about that.
Yeah. So, from my clinical work, I developed this research question. And so I'm researching and I'm interested in learning more about people's experiences of disclosing their OCD or telling others their OCD, and what that experience is like for them. Yeah.
And what is the goal of the research? What do you hope to learn from that?
Yeah. So studies in the literature have looked at the experiences of disclosure, experiences of mental health overall, but not specifically OCD. So, really trying to see and learn more about people's experiences of OCD in particular, and kind of relating, and it came out of some of the things that we were discussing earlier. And thinking about if there are any connections with, we're looking into various different possible connections of, if there's any connection between OCD subtype and severity, but also the impacts that it might have on quality of life, experiences of shame or self-stigma. So we're interested in learning about all of those different aspects of people's experiences of disclosure. Yeah.
Okay, great. So a study participant would have to be what? Someone who's been diagnosed with OCD, or who would be a proper participant for you?
Yeah, so somebody who has OCD, who's over 18 years of age, and also has disclosed their OCD to other people, so has told other people about their OCD. And those other people could be family, friends, coworkers, romantic partners, bosses. So we're trying to get kind of a whole scope of people.
Mhm. Okay. And
Mhm.
somebody met the qualifications and they wanted to participate in the study. Two questions. One, does it cost anything? And number two, how do they actually do it? Do they come in for an interview with you, or how do they actually do the study?
Yeah, so it's actually really easy. So it's an online survey. So I have kind of a flyer with a link, and people click on the link and they go to it. It's a relatively short survey, so it should take 10 to 15 minutes to complete. It doesn't cost anything except some of your time. And yeah, so it's quick, easy, click a button, you answer some questions, and you help us out and help us kind of learn more about these experiences.
Mhm. And if somebody participates in the survey, can they expect any sort of follow up, or is it sort of a one time thing they do and they're done?
One-time thing and they're done. Yeah.
Okay. And would they be notified of the results of the study once you complete all of the data crunching and all the things that you need to do to write up the study?
Yeah, so it's an anonymous survey. So no, I wouldn't have that information for them. Yeah. So it's anonymous as well. I should have mentioned that earlier, but yeah, so none of your information, kind of anything will be taken.
Okay, well that's good to know.
Yeah.
So
Yeah.
Well, I will put that link beneath the video in the description part, so anybody who wants to participate in the study be able to, go ahead and do that. It's, if it's anonymous and as easy as you say, of just answering
Yeah,
questions,
yeah.
I encourage
It's
everybody to participate. The more participation, the better the study results, right?
Yes, yeah. And thank you so much. And we would really appreciate anyone taking this and yeah, helping us out and get more information on these experiences that are so important and impactful for people.
Mhm.
Yeah.
So, just out of curiosity, we're talking about a particular study that you're doing, but I know you're in an institution, like you said, that does a lot of different studies and things. Just for sake of sharing with people what types of studies happen out there, can you give us just a taste of the different types of things that might be studied in an institution like your own related to OCD?
Yeah. Ooh, there are a lot. So I know there are a couple of studies that are looking at the genetics of OCD, particularly for um, Latino populations, and that aspect is kind of ongoing. There's also studies going on about treatment in general, so kind of how it works with children and things like that, and the effectiveness of it. We also have studies going on about using affective computing technology. So things like if people are familiar with the camera on your iPhone and it detects your facial characteristics, using that to help kind of detect negative emotion states in people, social interactions to possibly kind of help with diagnosis as well. Yeah. So we've got lots of different studies and lots of different areas, and that is just a teeny tiny bit of it. So yeah.
So is there a different website or link or something that I could include beneath this video for people who want to learn and maybe participate in some of the other studies as well?
Yeah, so there's a I can actually send it to you. There's Baylor College of Medicine has an OCD clinic website, but then there's also kind of a specific page within that that has research studies and ones that are actively recruiting participants too.
Oh, wow. Well, that's great. So,
Yeah, websites have it all.
yeah, I was gonna say if you're someone with OCD or believes that you have OCD and you're watching this podcast and you want to help further the science and the learning behind OCD treatment and understanding where it comes from and why we have OCD in the first place. I know, there's a lot of theories out there, but we still have a long way to go to know the answers to some of those things. And the more people that can participate in studies like you're describing, the more that science can, reach some conclusions and provide better help. So everybody wins if you participate in these studies. Now, again, let me just make sure. Is there any cost to anybody to participate in studies in general?
Well, so actually most of the studies are in Texas, so that's kind of a piece of it, and then some of them do require you to like travel to the clinic and things like that. So it would depend on the particular study that people are looking for or looking at.
Okay, but if they found a particular study on the website that they were interested in, they could contact the appropriate person and get all those details.
Yes, exactly. Mhm.
Okay, all right. So one more question for you for
Yeah.
this is for Molly Church. So what is Molly's next 5-10 years look like for Molly?
Yeah, good question. And an interesting one, especially kind of the trajectory of my career, right? Just ending graduate school. But really, I want to be a therapist providing clinical care for people, any ages, kids, adolescents, adults, anybody, and specializing with OCD and anxiety and providing evidence-based treatment for that and helping people get part of their life back and the things that they value from OCD and living a better quality of life. Yeah, so that's really what that looks like for me. I love doing what I do and helping people. So
Yeah, no, we're lucky to have people like you who are working in an area that is relatively underserved, meaning there's just not a lot of people out there who are trained to treat OCD and some of the
Mhm.
disorders. So
Yeah, and that's also kind of training and supervision and all of that is also on the horizon somewhere in that 5 to 10 years. So keeping that going as well and helping further the field overall.
fantastic, fantastic.
Yeah.
'Cause you're obviously very knowledgeable and you'd be a great mentor to others who are starting out and trying to learn. So
Thank you.
so what about if there is somebody who's on this podcast that is listening and they're from Texas and they believe they have OCD or they have someone who they think might have OCD, is there a way
Mhm.
to get in touch with you? Is there some sort of an email address to the program? Like how would they actually find treatment?
Yeah, good question. So the Baylor College of Medicine OCD Clinic has a intake that they do, and so people would call. If you go to the website, there's a number that you would call to schedule an appointment. And I know that there's a long waiting list because as you're saying, the need for these services is so great, but they would call, speak with someone and get signed up for an intake to get that official kind of assessment process to see if somebody does have OCD. And then if all is good, they get care here at the clinic and therapy here. So
Okay, so that raised one other question in my mind. So let's say they do call and they get, accepted and they start to work with you all. How does that work? Is it just like coming in, meeting with the therapist face to face? Is it online? Is it they come in and they live at the clinic for a while? How does it actually work?
yeah, it's an outpatient clinic. So appointments can vary based on the severity. So typically it's once a week, but sometimes if people are more severe, we can do more than that. Um, we do virtual appointments, especially because Texas is a large state, so people can get care here from anywhere in the state. People also come in person and do sessions, and so it's easily accessible to whatever people are needing, and we do the same treatment either way. So exposure and response prevention. Yeah.
Fantastic. Wow. Well, this has been really exciting and really interesting. I'm so glad that you are doing the research that you are doing and that the other folks in your clinic are doing their research. It's so sorely needed and I'm excited to try to, I always try to get in copies of the studies when they come out to see what's the new information out there. And then I try to do a podcast about it to share that information with people. So, I'm really lucky to have you on the podcast and I appreciate you taking your time. I am going to share the link to your study below and I'll share the link to Baylor College of Medicine OCD Clinic so people can go there as well if they want to get in touch. Is there anything that I'm forgetting before we wrap up?
I think so. I think you hit on it all. Thank you so much for having me and also for having this podcast to spread information about OCD and anxiety. Like we said, it's very needed. Yeah, so thanks again.
Yeah. Well, thank you. And if I receive a letter in the mail from you and I see that it has a signature line about that long, I'll immediately know it's from you.
Yes, very long title. Yeah.
All right. Thanks so much for joining us and thank you for
Yeah.
sharing info with the audience.
Yeah. Thank you.